Hi, I'm Julie Hill with Movement Therapy. I help people eliminate pain and get back into doing the activities that they love through functional movement and functional breathing. Often people wonder what functional movement is. Really, it's a form of assessment, watching how the body's choosing to move, and then understanding the relationships between the muscles. We can do this through simple assessment and then through a muscle testing protocol. So we can look at when you stand up, if you have a leg that commonly rotates open, so maybe your right leg, the toes just kind of V out, but the left leg, the toes are forward. It tells you a little bit about the relationship between the back of the hip, your rotators, and the front of the leg, right? You can have pain from that coming up into your back on the outside of your hip or even through the other leg. We can also do an assessment here of just taking the legs wide and letting the hips shift over to one side and then back to the other. Maybe they easily flow over to one side, but when you bring them back to the other side, there's kind of a stop short, telling you there's a relationship between the adductors, the inside of the leg, and the abductors, the outside of the leg. And then working to understand what is overworking there and what is underworking so that correctives can be put in place. You also might find as you shift your hips back and forth that there's a little bit of a swivel with your hips. So maybe one side, the front of your body stays forward, but when you go to the other side, there's just this kind of rotation with your hips to kind of the other side. Again, telling you about those rotators in the back, right? Could be from one side to the other side. Identifying and starting to see this assessment is the first step forward to finding a release for the pain that you're feeling and bringing that body back into how it was designed to move. You can find out more information about what I offer at juliehillmt.com, or you can check out one of my classes. Information below. I hope to see you soon.